Delegates, awardees, organisers, funders, volunteers, welcome all of you to this beautiful hotel in Cape Town. We have views of Table Mountain, we have the ocean. NCAM is an essential programme for accelerating the capacity of low and middle income country researchers to make sure that you can involve lived experience, manage your grants well, and become the leaders of tomorrow.
Embedding lived experience within neuroscience research is still very much in its early days, especially for those who are doing more basic research. But in terms of the outcomes of the research, we know that research outcomes are much more meaningful for people with lived experience when their ideas and perspectives are included in the research from the start.
Funders' perspective sessions in seminars like NCAM, which is especially a capacity building seminar, is crucial. It gives early career researchers the opportunity to interact with funders. They can align their research to even give greater impact for the funders' goal.
So the NCAM program or the NCAM workshop has actually highlighted a number of areas that I actually thought I could improve. So one of them was grantsmanship and the other one was also leadership. In terms of grantsmanship and preparation and data management, it's actually giving me some template as to how to approach it while involving people during the process, and it makes research relatively relevant for the general public.
The NCAM seminar prepared me for the future grant by learning the 7 magic formula, which was missing in my previous grant, particularly about the visibility. As being a researcher, we are always weak to share our presence on the social media and share my outcomes with my colleagues, and let the world should know the findings, what we have achieved from this conference.
So as a participant of the NCAM Capacity Building Seminar, I have the opportunity to expand my network and also to acquire new knowledge. But also something really important is that now I am really aware of the high responsibility that we have as a scientist to contribute meaningfully on the ongoing challenges that we have on mental health research.